1039 on KOA News Radio. We were talking this past week with the passing of Chadwick Boseman, the actor, in really untimely fashion. He was in his mid-40s. He died of colon cancer. And the importance for everybody to make sure that you get screened and you are understanding of the importance of that. And that's hard, right? That's difficult because a lot of people don't know too much about that. Dr. Matt Karowe would not be one of those people. He's with the Gastro Center of the Rockies and deals with this on a regular basis and joins us now today. Dr. Karowe, thanks very much for your time. It's Dave, Logan, Rick Lewis, and Kathy Lee. Good morning. How are you?
Good morning. Good. I'm very good, Dave. Thank you for having me.
Absolutely.
It's a pleasure to be here.
Yeah, we're happy to have you. So we'll just jump right in with colon cancer, which is obviously a deadly cancer. When people see stories like what I just mentioned with Chadwick Boseman, the really talented actor that died in his mid-40s, then it does raise awareness of that. But then if you don't follow up on it, it tends to sort of hide in the background. So talk a little bit about colon cancer and the importance of being proactive, and what exactly, for people listening to the show, what exactly does being proactive in this regard mean?
Okay. So colon cancer is the third most common cancer in the United States. About 150,000 people are diagnosed with colon cancer every year. I think this year it's going to be dropping to number 4 because of the screening tests and the prevention and the improved treatment. There are approximately 50 to 55,000 deaths every year from colon cancer. It's the second leading cancer death in the United States. It grows slowly from polyps into a cancer, and it takes a long time. So if you can find those polyps and remove them, you can prevent the cancer. In addition, if we diagnose cancer much earlier, the treatments are much better and the survival rates are significantly improved. So we talk about colon cancer screening, and the Colorectal Cancer Screening Multi-Task Force recommended a number of different tests that are labeled as Tier 1 or Tier 2. The Tier 1 tests are colonoscopy and a FIT blood test in the stool. That's an annual test. These allow people to be diagnosed much earlier in the cancer stage and remove polyps prior to them turning into cancer. The second tier tests are the CT colonography, the DNA stool tests, and the flexible sigmoidoscopy. We have significant data that these are effective in reducing death. The death rate has decreased 50% over the last 50 years. The incidence of colon cancer has also decreased, I believe, related to the removal of polyps. The incidence has decreased, interestingly, in the 55 and above age group, but has increased in the 55 and under age group. The American Cancer Society recommends to start colon cancer screening at age 45 now. Our national GI organizations have not yet followed suit, with the exception that there is data in African Americans that they develop cancer earlier, and they should start at age 45 as well.
Hey, Dr. Karowe, it's Rick Lewis here. There's a relatively new screening, and it's the virtual colonoscopy, which my doctor recommended because he says you can see a lot more in better detail. The downside is if you have a polyp, you have to go get a regular colonoscopy and have it removed. What are your thoughts on the virtual colonoscopy, which also includes, you can take a look at spleen and liver and lungs and all the other organs as well?
Yes. For colon cancer, it is that's the CT colonography, which is the Tier 2 test. It is not as accurate to look and find flat polyps, and many of the polyps that we're finding today are right-sided flat lesions. It does have the benefit of looking at all the other organs in the abdominal cavity, so you may have incidental findings or other things that are important to deal with. It is, unfortunately, the same type of prep for the colonoscopy, and usually you're not sedated for it. So a lot of people who undergo it are reluctant to do it again. But it is a very good test. And I always tell people any test is better than no test. Please do your colon cancer screening of any type. And that does include the stool tests.
Sorry, Dave.
All right.
Regarding I think that Cologuard or whatever it is, during the pandemic, people couldn't go and get these types of screenings, unfortunately. Is the Cologuard, is that a reasonable substitute?
It has a significant place in the colon cancer screening protocol. It is, again, the Tier 2 test. That's the DNA stool test. It has a number of false positives. I believe the data says when you have a positive test, there about 4% of the time there might be a cancer, up to about 50% of the time there are polyps. So it is certainly a reasonable alternative. It is not considered the gold standard. Colonoscopy is the test that is shown to have the best reduction in colon cancer incidence and deaths. Any test is better than no test.
We're talking to Dr. Matt Karowe from the Gastro Center of the Rockies on colon cancer and screening. Let me ask you, just generally speaking, doctor, for people listening to the show, what's the age that you recommend that people start to get screened, start to talk to their doctor about colonoscopies? I know that family history plays a role in this. Race, as you mentioned, plays a role in this. Just give us a general overview on what some of our audience should be aware of moving forward.
So we separate them into what we call routine risk and increased risk. So the routine risk are patients who have absolutely no family history of colon cancer, colon polyps, or a history of a non-advanced adenoma in a first-year relative. The patients who are at routine risk are currently recommended, as I said, by the American Cancer Society at age 45. Our GI societies, I believe, will follow suit. They make a recommendation every few years in this U.S. multi-task force on colorectal cancer, and I do believe they will be starting to do 45. But currently, the GI organizations say 50, except for African Americans that are 45, and the American Cancer Society says 45. If you have a family history, that will change significantly. So if you have a relative, a first-year relative who had either a colon cancer or what we call an advanced polyp under the age of 60, you need to start 10 years younger than that individual, or age 40, whichever is the sooner of the two. So
is there an age?
Different people, but on average, 45.
Is there an age limit? I have elderly parents, and I think I remember them saying at a certain age it's recommended not getting screened anymore because of the risk.
Yeah, so it's based mostly on the life expectancy because these polyps grow slowly into cancers. If you're unlikely to be developing or having an issue with dying from a cancer, they're not recommended colonoscopy. So I believe all of the guidelines say somewhere after 75, you stop. Based on a approximate 7 to 10 year life expectancy. Now that's just routine screening. If you've had polyps or you have symptoms or you have other things that need evaluation, you should still obtain that.
You know, before we let you go, last question for me. And you mentioned the age. You mentioned also that colon cancer ranks up there in terms of number of deaths caused in our country. Are we seeing the numbers stabilize at all? Are we continuing to see numbers rise? What do the numbers tell you in terms of deaths from colon cancer?
So the numbers tell me that in the last 20 years, we have made good inroads in decreasing cancer deaths in patients 55 and older. It is clear. Unfortunately, it is increasing in the patients under 55. And I believe that is why the new recommendations will drop down to age 45 for almost everyone with routine screening. But I have seen a decrease in colon cancer diagnosis and deaths during my 20-year career here in Boulder, Colorado.
That's awesome. Doctor, pleasure to catch up with you. We appreciate the time, and hopefully people listen to this and become proactive, even taking another step with regard to colon cancer and screening. Thank you very much, Dr. Karowe.
You're very welcome. Thank you for giving me this opportunity.
You bet.
Have a good day.
You do the same. That's Dr. Matt Karowe from the Gastro Center of the Rockies on colon cancer and screening.